Hi, I'm Dr. Samantha Pillay, a urological surgeon. What is underactive bladder? So, underactive bladder we use to talk about someone whose bladder muscle has lost power and just isn't really strong enough to push the urine out as effectively as it should. And it can cause a number of different symptoms. Sometimes, as the bladder starts to fail, people notice that it's just not as easy to pass urine. Maybe just sometimes in certain circumstances, like there not being enough in the bladder or too much in the bladder or having a full bowel or being in a rush. But as it gets more severe, people can notice symptoms where the urine seems to come out slowly, or it stops and then starts again, or stops and starts, or they have to push or bear down, lean forwards, rock, or push over their bladder with their hand to try and get the urine out. There are people who, men sometimes, if they stand to pass urine, find that it's easy to sit down, and women who sit down find that it's easier if they sort of stand or hover over the toilet. Um, so it can cause problems if people don't actually empty as well, where one of the things is they have to pass urine more frequently, because if you only empty a little bit out, it doesn't take as long to before your bladder fills up again. It can lead to an increased risk of urine infections, and it can even stretch the bladder over time. There is a possibility it can even be quite serious, where it can cause back pressure to the kidneys or kidney damage. So often it can require further investigation, and one of the tests that's often involved investigating the bladder is urodynamic studies. There's more information available on our website about urodynamics and underactive bladder. It's also these symptoms are seen in people who don't have underactive bladder. So it can be important to rule out other things. So if there's a blockage, something in the way, creating difficulty with the urine getting out, and in men that can be prostate enlargement. Women, it could be women who've had surgery like a sling or stress incontinence surgery that's actually caused some blockage and difficulty emptying the bladder. So it is important that you see your health professional if you're experiencing these symptoms, to look into them further. And our Continence Matters website is a resource, but not a substitute for clinical or medical advice.